Good afternoon, everybody. Thank you for joining me this afternoon. Today, we're going to talk about benefits basics. I recognize a few of your names, so welcome. I'm glad to see people I've known before. Today, we're going to talk about the New York Employment Services System, and that's where I work. So I wanted to give you a little information about that. We also want to talk about why employment is a good idea. We'll talk about benefits advisement, and you'll notice that that will be my commercial throughout the entire presentation, that anybody on public benefits should have benefits advisement services. We also want to talk about employment myths and facts, Social Security benefits and various work incentives that go along with them. We'll talk about ABLE accounts and past plans and a little bit about Ticket to Work. So we have a lot of information to cover, and we'll go ahead and get started. There we go. So the New York Employment Services System, I don't know if anybody has actually heard the story before, so I wanted to share it, but on this slide are all of the state partners that NYESS participates with. We collaborate with all of these state partners. But a long time ago, the Office of Mental Health and the New York State Department of Labor came together and recognized that there was a gap in employment resources for people with disabilities throughout the state of New York. And so they created the New York Employment Services System. So that's how we came about. Oops, I'm trying to change it. There we go. So when you think about NYESS, we are not only the state partner of all those other state agencies on the slide, but we're a collaborative employment services case management system. And what that means is that providers or people in the community add information into our database related to employment services. And then we also are an administrative employment network for Ticket to Work, one of the largest in the country. We are also a primary employment services data source. And what that means is that oftentimes the information that we gather in our data system can help inform policy in New York State for people with disabilities. But aside from all those things, our most important focus is being a resource for all things related to employment. So as we go through this training today, if you have any questions or need any information or help with anything employment related for the people that you're serving or for yourself, please feel free to reach out. We'd be happy to help you with that. So the next topic that we want to cover is why employment is such a good idea for people. And as you're helping individuals think about going to work and what that means, it can be kind of a daunting task. People are oftentimes nervous about going to work for various reasons. But it's a really good idea to start employment conversations with why employment is actually good. And one of the things that we like to focus on is it is a social determinant of health. So research has shown that people who get a job, who go to work and maintain employment, have improvements in a lot of areas of their life. So including the financial health, that they're going to work, so they're getting a paycheck. So that's better. But also physical and mental health are both improved. Socialization, being out in the community, talking to people, giving individuals a meaningful activity, improving somebody's self-worth, overall improvement in their work ethic, and then an overall improved quality of life. People just feel better about themselves and about life in general when they do have a job. In addition, there's been research that shows that there's a reduction in the need for interventions when people are employed. So overall, it's a really good idea. And so as you're talking to people about getting a job and going to work, it's a really good idea to stress those positive things that they can experience at work. And so when we talk about going to work with somebody who is on public benefits, it's a really good idea to stress that it's still a good idea to go to work, but there are some things that people need to know about when they get ready to go to work and they're on benefits. And you don't have to be an expert when you're going through this conversation with them, but there are a couple of basic things that you should understand and be able to relay to them. So individuals will have more money in their pocket and they're not penalized for going to work while they receive Social Security benefits, but they have to report their income on a monthly basis. And individuals are typically eligible for free Medicaid in almost all scenarios. And we'll talk about those options today. There's also some common anxiety and frustrations associated with public benefits. And we have to recognize that those are real and those need to be a part of that employment conversation. So every social service agency out there has a different criteria for their eligibility and what it means to them for somebody to go to work. And so that can be frustrating to know what you're eligible for and what happens if you go to work and how that benefit will be impacted. And there are common myths about what happens when somebody goes to work, and they're not real. And so we need to also make that a part of the conversation so that people have a real idea about what it means to go to work and how that will be impacting them. So again, this is going to be my commercial, right? Anybody who is on public benefits of any kind, regardless of Social Security, they should be connected to a certified benefits advisor. And that is somebody who has gone through training and gotten the credential certified benefits advisor. Sometimes it's certified work incentive practitioner. Sometimes it's a certified work incentive planning association. Anyway, they're called by different names, but the bottom line is they are certified benefits advisor and can provide information for individuals about how their benefits will be impacted when they go to work. And each situation and benefit financial picture is different. So two people side by side could be on the same benefits, but they are going to be impacted in a different way based on their employment goals and their employment situation. So it's important to be able to connect somebody to a benefits advisor and not try and pigeonhole everybody is the same way. So it's really important that you have a go-to benefits advisor. And if you don't have one that you can just pick up the phone and call or refer somebody to, or if you're not certified, then please give us a call and we'd be able to help find one for you. We on our website, the NYESS.ny.gov, is a locator map. And you can click on benefits advisement, put in your zip code, and you'll be able to find a benefits advisor within your area. And so we developed that directory of certified benefits advisors because there's such a gap in some areas of the state for services. And we felt like it was really important to be able to give that information to people. The other thing that I wanted to mention is that it's important to have a website that you can go to related to benefits. And there is the Ticket to Work website, which is choosework.ny.gov. And that has information about benefits and the Ticket to Work program. Our website on our customer resource page has information on a variety of benefits and work incentives that are available for individuals. So if you don't have a certified benefits advisor to refer to, or you need a website to research information for yourself, please reach out. We'd be able to help you find that. So another thing that's really important for you to know is when you're talking to somebody about going to work, it's important to know the different types of benefits that are out there and the various work incentives that are attached to each benefit type, so that when you're having a conversation about going to work, you can talk about the specific work incentives they might be eligible for. Now, if you're not a certified benefits advisor, this is just basic information you're sharing with them, but then you'll be referring them to someone who can actually work through that with them. But SSI and SSDI are completely separate Social Security benefit types, and they calculate wages in very different ways. And we're going to talk about those in a little bit. Wages must be reported in all scenarios to reduce the possibility of overpayments or related penalties. But sometimes an overpayment will happen. And if that happens, I would consult a benefits advisor to help that person navigate through the process. And if an individual earns enough money for cash benefits to stop, so they go to work and they're making so much money that they no longer get SSI benefits, then there are still ways for them to continue to receive free Medicaid. And we'll talk about those, the 1619B Act of the Social Security and Medicaid buy-in for working people with disabilities. In addition, sometimes people would like to save money. So maybe retirement is just down the road and they're thinking about how am I going to have enough money to retire? So they want to save some money, but if they're on SSI benefits, there's a resource limit. They can't go over a certain amount of money. So there are ways to save money. And one of those is an ABLE account. It's called an Achieving a Better Life Experience. And another one is the Plan to Achieve Self-Support, or a PASS plan. And we'll talk about both of those as well. So let's cover the myths and the facts. When you're starting these conversations with individuals about going to work, we've already talked to them about the positive aspects of employment. So let's talk about the myths that come up, and then you can share with them the facts so that they are not swayed, by a myth, but it's part of that employment conversation. So traditionally, it takes a long time to get Social Security benefits for people and other public benefits as well. And so sometimes people are really anxious about going to work because they don't want to lose those benefits. And sometimes family and friends hear stories or rumors about what happens when somebody goes to work on benefits and they lose those benefits. And so they don't want to encourage people to go to work because they don't want to lose those benefits either. So it's really important that we talk about all of these types of myths and the facts that are real for people. So a couple of them. So talk about some of the common myths that come up. So one of them is that I'm required to work under a specific number of hours in order to maintain my benefits. And usually that number is 20. People say I can only work 20 hours a week if I'm still going to keep my benefits. Another one is not being able to work because you have a disability. I can't work, I have a disability. Sometimes people are insisting that the individual be stable before they can go to work. And sometimes people are very concerned about losing healthcare benefits. So those are the myths, and let's talk about what the facts are surrounding each of these myths. So the first one, I can only work 20 hours per week if I want to keep my benefits. Well, there are several variables involved in being able to keep Social Security benefits. So hours might actually be one of those variables, but it depends on a lot of other things as well. It might also include the benefit type. So if they're getting SSI or SSDI benefits, that could make a difference. And it could be the hourly wage a person earns. And it could be the specific work incentives that they might be eligible for. So if they want to go to work and earn, maybe work 32 hours a week, $16 an hour, and then they are eligible for various work incentives, they may not lose their benefits. They may be able to maintain them as long as they can, until they reach that level where they're no longer able to keep them. But just because of hours, that's not the reason that they can keep their benefits. But again, a benefits advisor is the person who would be able to provide clarity for that specific situation. So the next one is I have a disability, so I can't go to work. And interestingly, Social Security had recognized a long time ago that people that are currently receiving Social Security disability benefits can actually work. And so they created the Ticket to Work program to encourage individuals to go to work and begin the process of gaining financial self-sufficiency. So an individual can be eligible for Ticket to Work if they receive SSI and or SSDI benefits, if they're between the ages of 18 and 64, and if they want to go to work. But it's important to let them know that it is a voluntary program. And that means that they don't have to belong to the Ticket to Work program. And if they decide not to, it will not impact their benefits. But the important thing to note is individuals with a disability can go to work. The next myth that comes up is I can't work until I'm considered stable by my psychiatrist. And this is a myth that individuals have to be ready or stable or even compliant with their medications before they can go to work. And it's just not true. So supports can be available to a person who to obtain or maintain employment even while they're managing their barriers to employment. So sometimes an individual is managing mental health symptoms, or there are housing or transportation needs, or even educational needs, but they can still go to work and get a job and maintain that job, even if they're in the middle of all these barriers to employment. So oftentimes people are even homeless and getting a job and maintaining that employment. So the key to this is being able to have supports in place to help that person manage those symptoms and manage employment. So oftentimes people are called natural supports, and an employment specialist may develop natural supports within the workplace, meaning a coworker or a supervisor or someone that the individual can go to in a crisis. If there's a specific mental health symptom happening, they know that they can go to that trusted person and get supports that they need on the job. So anyway, the whole point of that is people do not have to be considered stable as long as there are supports in place to help them maintain that employment. And the last one is if I go to work, I'm going to lose my healthcare benefits. And that is a huge anxiety provoking thought for people. And that is because they rely on Medicaid or Medicare benefits to help them get the services they need to be able to maintain their mental health or other disability that they may be experiencing. And so Social Security and Medicaid have come across a couple of programs that can help people maintain that Medicaid coverage, even if they no longer receive SSI benefits. In addition, there's a way individuals can maintain Medicare coverage, and oftentimes that's associated with SSDI in certain situations. So we want to talk about those in more detail. Okay, so why would somebody be concerned about losing their Medicaid coverage? If they go to work and they get a job, shouldn't they be able to get their employer's insurance? Well, in a perfect world, that would be a yes, but it doesn't always happen that way. Individuals may be earning enough money to lose their Medicaid, their SSI benefit, but that's not enough money that they're earning that they can get an employer's healthcare coverage. In addition to that, individuals receiving Medicaid coverage are able to get coverage for things that a regular or typical employer's healthcare coverage won't cover. So they may have attendant care services or prosthetic services or other pre-existing conditions that would not be picked up under an employer's plan. So it's really important to note that even if a person is going off of SSI, they still have the ability to maintain Medicaid coverage. And that's a relief for people because they've already needed that coverage. So the Medicaid 1619B rule is that it allows an individual to maintain Medicaid even if their earnings become too high for SSI. So if they're eligible for 1619B, it should be an automatic process. And that means that Social Security knows Susie Q, which is always my example, Susie, goes to work, she earns more money, and they know that Medicaid is not going to be able to be covered in the usual way because they're going to lose SSI. But there's a 1619B rule, and they will automatically switch her over to the 1619B. Now I've included a link to a template, and I'm not sure at this point, I'm not sure that that template works now. So somebody check it and let me know, and I can send you an updated document. But the 1619B template letter is a letter that you can complete, or the individual can complete and say, "Dear Social Security, I'm earning more money. I know I'm going to lose my SSI benefit, but I still want to maintain my Medicaid coverage under 1619B." And sending that letter to Social Security, their local office, will let them have like a heads up, this is going to happen, so that there won't be too much of a gap between when they need that Medicaid coverage and when it actually gets switched over from Social Security. Now, the gross income right now in 2025 is 64,000. A person can earn $64,000 as an individual and still maintain the Medicaid coverage under 1619B. The asset limit is still $2,000. So with SSI benefits, their resource limit can only be $2,000. And that means anything that can be turned into cash. So if they have $2,000 in the bank account, that's the limit. That's all they can have. But it's anything turned into cash. So that can be a retirement benefit, like if they have retirement account set up somewhere, or if they have cash, or if they have any income that's coming in that's not related to their job, but like child support payments, that all can be turned into cash, and that could be the asset limit is $2,025. The thing about the asset limit, though, is that it doesn't count like if they own a home or if they own a car. Those things are not counted in the form of the asset limit. There are some eligibility requirements for Medicaid 1619B, and that is the person would have to be eligible for SSI for at least 1 month. They would be eligible for SSI cash benefit, except their earnings are too high. So they've lost SSI because they're earning too much money. They also have to still be disabled according to the Social Security disability definition. And they still meet all of the other eligibility rules, including the resources test. The individual needs Medicaid in order to go to work, because without it, they're not getting their medications, or they're not getting therapy, or they're not getting some other services that Medicaid allows. And they have gross earned income that is insufficient to replace SSI or Medicaid. So again, if they are making a lot more money, but they still can't afford their employer's healthcare plan, they need that Medicaid. So those are the eligibility requirements to get the 1619B. And again, that is the only one that is considered an automatic process. So that would be important to pass along to the individual. Okay, the next is called the Medicaid buy-in for working people with disabilities. And as I mentioned, 1619B is automatic. The Medicaid buy-in is not automatic. They actually have to apply for this service, this benefit type, in order to get it. So the Medicaid buy-in program offers Medicaid coverage to people with disabilities who are working and earning more than the allowable limits for regular Medicaid, and it's free. So even though it says buy-in, right now there is no premium that you have to buy in to it. They have to, or they can have gross income as high as $75,000 for an individual. And they can have resources up to $31,175 for a one-person household. So it is exponentially better than the 1619B program. You can earn a lot more money, and you can have a lot more resources in the bank and still continue to receive your Medicaid coverage. There's a link at the bottom of this page that talks about the MBI toolkit. And the link goes to the toolkit that will tell you how you can get the coverage, where you go to apply for it, the intricacies of it, what it covers, how much money you can make, what level of resources you can have, all of that individual stuff about the Medicaid buy-in program is listed on the toolkit. The other thing about the toolkit, though, is it's currently being updated. So last year, legislation agreed to expand the Medicaid buy-in for working people with disabilities. And so we expect this year that there will be some changes, positive changes to the program. And so right now the toolkit is being updated. We haven't gotten the final word that it's been approved yet, but I do have a slide that talks about what those changes will look like. We expect that sometime in 2025, their age limit will be gone away with. So right now, you can only get the Medicaid buy-in for working people with disabilities to the age 65. But eventually, we think that there will be no upper age limit for this program, which is going to help a lot of people. In addition, the asset limit is going to be expanded to $300,000. And that's amazing, right? That means people who are ready to retire or putting money away for retirement can have a savings account with $300,000 in it. In addition, the income limit is going to be about $320,000 a year. So that allows a lot more people to be able to join the Medicaid buy-in for working people with disabilities. And it's a great asset because, as I mentioned earlier, individuals who are on Medicaid and get Medicaid coverage are perhaps getting it for very specialized services that they need. And if they were no longer getting Medicaid, maybe their employer-sponsored healthcare wouldn't cover those. So this way, they're able to maintain the Medicaid coverage they currently have, and they can earn a lot of money and do that, which is awesome for people. In addition, most of the individuals who receive Social Security disability insurance, they are also eligible for Medicare coverage. Now, that's not true in all situations, so there are exceptions to the rule always. But this is a generality. So individuals who are on SSDI benefits, and in this case, we're going to assume they have Medicare, following the trial work period, individuals can continue to receive at least 93 months, which is 7 years and 9 months of Medicare coverage. Hospital insurance is Part A, and they can get that premium free. Supplemental medical insurance is Part B. So if they've already been enrolled in Part B, that also is premium free. Prescription drug coverage, which is Part D, again, if they've already been enrolled in it, that's also premium free. So that's a long period of time, 7 years and 9 months, that they can get Medicare coverage for free. In addition, after that premium free Medicare goes away, that person can still buy continued Medicare coverage as long as they remain disabled. So it's a huge benefit for individuals to be able to maintain their healthcare coverage, whether it's Medicaid or Medicare coverage. Do you have any questions about anything up to this point? Okay, we'll go on. The next section is about benefits and the work incentives that go along with each benefit type. So because this is a specific SSI and SSDI are specific benefit types, and we want to make sure that we cover the generalities of each benefit. And so if there is a specific question that you have pertaining to your situation or the customer situation that you're working with, I recommend that you reach out to a certified benefits advisor so that they can actually look at your specific situation and give you detailed information. So this is going to be general information about both benefit types and the work incentives. So let's start with SSI. And SSI stands for Supplemental Security Income. And the SSI program provides a cash benefit payment to people who have limited income and limited resources. And it's important to note that when we're talking about SSI and SSDI money, that we take a look at the rates that are potentially changing on an annual basis. So the resource limit in 2025, it could potentially change, but it's still single individuals $2,000 for a resource limit, and an individual with a spouse is $3,000. Now, those resource limits have not changed in years, which is kind of sad. It would be nice if they did. But it's something that you have to pay attention to each year is to see if those resource limits have changed. And just like the Medicaid resource limit, these are associated with cash, anything that could be turned into cash. So not taxes. Gosh, I have taxes on the brain. It could be information about, child support payments that are coming in, or it could be money that you have in your savings account, or your tax information from Oh, there's a question that popped up, home ownership. So if the individual owns their own home or owns their own vehicle, they do not count as a through the resource limit. So anyway, an individual $2,000, if it's 2,000 in the bank, then that's the limit. If you have 2,001, you're over your resource limit and you have the potential to lose your SSI benefits. The other rate down here at the bottom of the page is the federal benefit rate. And in 2025, that is $967. So Social Security starts with $967, and then they start subtracting from it. So they'll start subtracting unearned income, which would be like child support payments, and then earned income, which would include the wages that a person gets from their job. And then they're also going to consider any work incentives that individual might be eligible for. So we'll take a look at those. So these are some of the work incentives. And so we want to talk about each one and kind of talk about what the parameters are in using the work incentives. So the first one is the student earned income exclusion. Then the next is the impairment related work expense. And you might have heard this as an IRWE expense. Then there's the blind work expense and subsidy or special conditions. So the student earned income expense allows somebody who is under the age of 22 to exclude some of their earnings from their income when Social Security calculates that benefit, SSI benefit. But the other thing is the person has to be regularly attending school, and it could be part-time or full-time, and they have to be working, again, part-time or full-time. So what happens is an individual who is working and earning money and going to school and is under the age of 22 would report to Social Security their income, which they should already be doing, and let them know that they want to use the student earned income exclusion. So in 2025, the amount that can be excluded per month is $2,350, up to an annual maximum of $9,460. So in our example, again, it's going to be Susie Q. Susie is 19, attending school part-time and working part-time. She earns $1,000 in January. So then she contacts Social Security and says, I went to work and I earned $1,000 in January, and I want to use the student earned income exclusion. So then once that happens, Social Security will use that $1,000 calculation wise to determine if the Social Security benefit, like SSI, will be impacted. And so because Susie can exclude up to $2,350 per month, she has not used her maximum amount for the year. So she can still use it for January, February, March, all the way up to 9 months worth. Once she reaches that 9,460, she can't use that exclusion anymore in that calendar year. But in the new calendar year, and the 2026 amounts may be different. So in 2026, she could start over and use that student earned income exclusion again. If a person earns more than that 2,350 in 1 month, the maximum that they can only exclude is that 2,350 for that particular month. But they could use it for multiple months in a row. And doesn't have to be consecutive, doesn't have to be consecutive months. So it's a great work incentive for people. The limit is that they have to be under the age of 22 in order to use it. So that's kind of a bummer, but it's a great one if it works for their specific scenario. The next work incentive we'll talk about is the impairment related work expense, or an IRWE. And IRWEs are costs for items or services that you need in order to go to work because of the disability, and the costs are not being reimbursed by anybody else. So Social Security will deduct the cost of the IRWE from your countable income when determining your eligibility for Social Security disability. So I've included an IRWE approval request form. And what that means is when you are spending money that you need something to go to work, like let's say medications. You have to pay a co-payment for medications. And let's say it's $25 just to make it simple. So you pay for your medication and you keep track of it and you keep a receipt for it. You put it on this early approval request form, the date, the name of what it is, and the receipt that you have with it, the amount you spent and the receipt, and you send it to Social Security and they approve it or deny it. So anything that they have approved will count as an IRWE expense the next time they determine how much SSI benefit you're going to receive. So in the next month, they can calculate it based on what you spent as an IRWE. So the next question is, well, what can actually count as an IRWE? And so these are some of the examples. If you're getting supported employment services, attendant care, transportation costs have a specific chart that we'll look at in just a second. Could be medical devices, prosthetics, co-payments for medications, or a co-payment for a doctor's visit. Any of those kinds of examples are examples of an IRWE expense that you can use. If we take a look at the transportation, we won't read the whole chart, but an example would be if public transportation is available in the community and it can be used by the individual, then that expense cannot be used as an IRWE. But if there is public transportation available and the individual cannot use that transportation, then the cost of a cab or a taxi or specialized vehicle could be used as an IRWE expense. So again, I'll leave that for you to read the rest of it. But basically, if it can be used, then there's no reason why it should not be, it cannot be used as an IRWE. But if it cannot be used under certain circumstances, it may be able to be used as an IRWE. The next work incentive is called the blind work incentive. And it's very similar to the IRWE because they're both costs for items or services that you need to go to work, and the costs are not being reimbursed by anybody else. However, the blind work expense does not have to be related to your specific disability. So if an individual has the disability of blindness or low vision, but they need something to go to work and it's not reimbursed by anybody else, it doesn't have to be related to their blindness. So if they need to dress in a suit to go to work, clothing could be one of those IRWE expenses. It doesn't have to be related to their disability. The costs do have to be considered reasonable. So according to Social Security, reasonable is a cost that is customarily charged for the covered or similar services or supplies. In addition, all of these other IRWE type expenses could be considered under the blind work expense, but again, they do not have to be required to be toward the disability, related to the disability. And the last SSI benefit work incentive we'll talk about is the subsidy and special condition. And a subsidy is the extra wages an employer pays an individual for services over the reasonable value of the actual services performed. So what does that mean? That means if there are two people who have the same job title and they're getting the same wages and they're expected to do the same job. However, one person is not required to have as much production as another person because of an accommodation, because they need an accommodation and they're not able to do the same level of productivity as the other person. And so Social Security will deduct the value of the subsidy from earnings. So maybe that person is doing 90% of the job. So that 10% is the subsidy because they're still making the same amount of money for the same job title. So Social Security will deduct the value of the subsidy from the earnings when Social Security makes an SGA decision. And contacting your local Social Security office to let them know that you'd like to submit paperwork for a subsidy. Then it goes through their local office and they go through an approval process. The employer will actually have to complete the form explaining and measuring the amount of the subsidy. Sometimes employers are hesitant because they don't want to say that this person is not doing their full job. But really, in the long run, it's a good benefit for people to get that subsidy paperwork because it helps them with their Social Security benefits. Another thing to consider is the special conditions exist when a worker receives support or services from someone other than the employer, potentially subsidizing the worker's ability to perform SGA. And it could be like a job coach coming into the job and doing part of their work. Maybe they do 15 minutes out of the first half an hour so that the individual can observe how that job is being done. And the third party may then provide that special condition. So those are really good also work incentives for people to be able to rely on to help them maintain their benefit as long as possible. And the next topic we want to cover is Social Security Disability Insurance. And I just glanced at the clock and I can't believe I'm talking so much. Sorry about that. Social Security Disability Insurance is also SSDI, and this is a cash benefit to individuals who have worked and paid into the Social Security program. So the eligibility would be like an average adult has to earn 40 work credits. So as you know, with Social Security, there's all kinds of exceptions to rules. So I'm just talking about an average adult. I'm not talking about youth or young adults. So an average adult, 40 work credits. Well, a person can earn up to 4 work credits per year. So that means 1 work credit per quarter. So if they, in January, February, and March, if they earned $1,810 in 2025, they can earn 1 work credit. And they have the opportunity to earn 4 in that 1 year. So that means that they have, in order to get 40 work credits, they have to work 10 years in order to make that happen. So Social Security will then, once they've earned those 40 work credits, and then 2 years later, let's say they get into an accident and they are, it's necessary for them to be on SSDI benefits, then they are eligible for it once they've earned those 40 work credits. And then to determine how much money an individual will receive, it's really based on the earnings over their whole working years. It's not really an average of the last 10 years. It's kind of, I don't know, it's earnings over the whole time that they've worked. And the specific rates have the potential to change at the start of each new year. So the number of credits, work credits, and the amount of money they have to earn a work credit could change on an annual basis. So Social Security Disability has a couple of work incentives that are associated with that. And I also wanted to mention that the IRWI is another work incentive that we talked about with SSI. It is also available for SSDI benefits. The first one we'll talk about is the trial work period, the extended period of eligibility, and then the expedited reinstatement. So the trial work period, an individual gets on SSDI benefits, and then Social Security allows them to have 9 months of what they call a trial work period. And this allows you to test your ability to work for at least 9 months without losing your SSDI benefit check. So you'll receive your full SSDI benefit regardless of how high your earnings might be, as long as you report your work activity and you continue to have a disabling impairment. A lot of times people will say you can even make Bill Gates money. And if you know who Bill Gates is, he earns a lot of money each month. So that means that there's no limit. You can earn as much money as you want to during that 9-month period and still keep your benefit check. And your trial work period begins when you earn over $1,160 per month. That is called the trial work level. In 2025, that's how much it is. And this level may change every year, so that's something to keep on top of. But what happens is if I'm on disability benefits and my first month I get my check, I earn $1,000. That month does not count as a trial work level. And then in February, I earn $2,000. So February is going to be the first month that is counted as my trial work period months. Then in March, maybe I earn $6,000, and that'll be my second month in the trial work period months, but I still get my SSI or SSDI benefit check. So it can go that way for 9 months. It doesn't have to be consecutive. It can be every other month or however it works out. But if you earn over that 1,160, that month will count as one of the trial work period months. So here's the example. If an individual earns 1,160 in January, Social Security will count that January as the first trial work period month. But if the individual's income falls below that in February, that month is not going to be counted as one of those 9 trial work period months. And the trial work period months do not have to be consecutive. The next process is as soon as the trial work period ends, that 9 months has been reached, the very next month is called the extended period of eligibility. And this is a 36-month period in which you will receive Social Security cash benefits for all months your earnings are below what they call an SGA level, if you continue to have a disabling impairment. So once the trial work period ends, an individual earns over SGA, which stands for Substantial Gainful Activity, and in 2025, that number is 1,620. And the first time they're over that SGA level, then Social Security begins the process to terminate the Social Security benefits. And they start with a cessation month and then 2 grace period months, and then you no longer receive your benefit. However, if during this 36-month period, the individual earns under SGA level again, then they will be able to receive their benefit check again within that 36 months. So in January, if we're over SGA level, then February will be cessation, March will be grace period, and April will be grace period, and my benefits would terminate. I would not receive any more after that period of time. However, then if something happens and I lose my job, I fall under the SGA level, I can contact Social Security and let them know I am under SGA and to please restart my SSDI benefits if it falls within this 36-month period. And the last one is the expedited reinstatement. And what that means is that the individual has gone to work and they have successfully returned to work, meaning that their Social Security disability benefits have been terminated. So they're working and they're earning enough money over SGA level and their benefits are terminated. But what happens if something catastrophic happens? They lose their job, they have to be hospitalized, they're no longer getting wages. And so if it happens within 5 years of the termination of their benefits, they can call Social Security and ask for an expedited reinstatement of their benefits. And during this process, they can ask Social Security to give them their SSDI benefits while they're making their decision on whether or not to return the benefits. So during that process, the individual will be able to get their benefit check, and they don't have to pay it back to Social Security if after 6 months they say, nope, you're not entitled to your benefit anymore. So that's a good thing. Social Security may say, yes, you're entitled to it and just restart your benefits on the regular schedule. Or if they say, no, you're not eligible for it back, then they may encourage you to reapply for benefits. Sometimes what happens is somebody's disability or diagnosis or symptoms gets better. And so at the time of this expedited reinstatement, Social Security is looking to see if they meet the adult definition of disability. And if the individual does not now, but they used to, then they would say, no, I'm sorry, you're not going to get your benefits back. And then if you have a new diagnosis or new symptoms, you can apply under that new diagnosis for Social Security benefits. Then the next couple of slides, we are running out of time, so I will try to expedite this a little bit, but an ABLE account is a savings account for an eligible person with disabilities to have resources that would make them ineligible for other benefits. So if a person receives $10,000 in an inheritance and they put the money in their savings account, they're automatically over the resource limit and they would lose their SSI benefits. However, if you put it in an ABLE account, it does not count toward the resource limits for your benefits, and you can still receive your SSI benefits and have this money in an ABLE account. You can contribute up to $19,000 in an ABLE account and up to $100,000 in the account before it impacts your SSA benefits. So you can add to it, your family, your friends, your representative payee, whoever that might be, can add money to it for a total of $19,000 in this year, and then up to $100,000 in the overall life of the account. You can use the money to pay for medical and living expenses in order to maintain your health, independence, and your quality of life. So that's a pretty broad definition right now. And I would suggest that if you are taking money out of an account to spend it on something, that you keep documented records and receipts for what you spent it on in case you were ever audited for what you used it for. A PASS plan is a plan through Social Security. So it's something that has to be approved through them. It's called a plan to achieve self-support. And what they're focusing on is if you need something in order to go to work, to help you reach that goal, they can set up a plan, like a savings account, to help you get there. So it would be a very specific time frame and dollar amount. And once you reach that, then you buy whatever that was you wanted to buy to help you with your goal. So if you need a car to go to work because you don't want to take the bus to work anymore, so you're going to put $200 in a savings account for 2 years. And at the end of that 2 years, you're going to pull that money out and you'll buy a car so that you can go to work and you no longer have to take the bus to go to work. There are some very specific things that you can spend it on, but it's kind of broad. So there's a lot of different types of things. If you need school supplies because you're going to be going to college and you need a computer system, or if you need childcare benefits, you know you're going to have to pay childcare for 2 kids, and that can be very expensive. So you're going to save money so that now, well, in the future, you're going to be able to take that out and pay that money. So individuals, you can go to work and pay for the childcare expenses. It's kind of, it's a great plan. It does need to be approved through Social Security, and they're not very flexible on extending it. Like instead of 2 years, I need to go 1 more year. They're not very good about doing that. So it's something that you really have to get some thought into and figure out how much money. But you can put it together and take it to Social Security, and every local office should have someone who works on PASS plans. So you ought to be able to connect with somebody to talk to them about either how to do it or to get approval for the plan itself. This next section is about Ticket to Work, and we talked just a little bit about it already. It's a program through Social Security that allows people to go to work and receive employment services at no cost, and to be exempt from the continuing disability review. However, to be exempt from that continuing disability review, you have to be making timely progress. And Social Security will check up to make sure that you are making timely progress. And that means going to job interviews, getting a job, maintaining a job, or attending a qualified educational program. It's really a good idea to connect with someone who is a benefits advisor as you are going through the ticket program, because you are on benefits, and they can help you monitor that impact on your benefits. This last section is just various resources that I've put together that you may find helpful. Social Security myths and facts. We have the Job Seeker's Guide for Employment. Please feel free to print these out and give them to whoever you want. Certified benefits advisors are through the New York State Department of Labor. They're called Disability Resource Coordinators in upstate New York, and they are called Program Managers in New York City. That is where you can get to the New York Scion, which is the which is the Department of Labor Scion project, who supports those benefits advisors. And then there's my information. If you have any questions or need assistance, please feel free to reach out.